Since 2015, Pop Health Podcast has brought to you some of the best minds in healthcare, including leaders from government, not-for-profit, and investor-backed powerhouses, as they share successes, failures, and how our audience can move forward in today's constantly evolving healthcare world. Thank you for joining us for today's episode presented by 24 Hour Home Care. Hello, everyone, and welcome to another episode of Pop Health Podcast. I'm Gavin Ward, co-host of today's episode, as returning co-host April Stewart joins the show. April and I have the privilege of sitting down with Alex Briscoe, who is the leader for the California Children's Trust, which is a 5-year initiative to really reshape and redefine how kids' behavioral health works. In today's episode, we learn about Alex's journey into behavioral health, which actually started in Pennsylvania, but early on in his career, he made his way out west, fell in love, and established some roots here in the Bay Area, where now he's considered one of the thought leaders for kids' behavioral health here in the state. We hope you enjoy today's show, where we learn about things like SBHIP and other initiatives that hopefully will reshape and redefine kids' behavioral health. We hope you enjoyed today's episode. Check out other episodes of Pop Health Podcast by visiting us at pophealthpodcast.com, checking out our YouTube channel, or listening to our show wherever you listen to your podcasts. Thanks, everybody. Enjoy the show. Alex, thanks so much for joining the show today.
Thanks, Gavin. Pleasure to be here.
Absolutely. So really excited. Co-host April is back today. April, thanks for joining as well.
Thanks, Gavin.
Absolutely. So Alex, we'd like to kick off our shows by getting to know the guest a little bit. Can you tell us something about yourself, maybe outside of the behavioral health world, something out of the workplace, a fun fact, hobby, something like that?
I'm a decaying pickup basketball player. I still drag my 51-year-old self out to play with 20-somethings. It's kind of one of the things I try to do for free time. Yeah.
That is awesome. So you are in the San Francisco area, and as we're recording today's show, we got the finals coming up. So do you have NBA loyalties to anybody?
Well, my children were born in San Francisco, and I try to describe to them that human suffering means being a Philadelphia fan where I grew up. They've grown up with like San Francisco Giants and the Warriors and championship after championship. And so I think it's come a little too easy to them. But yes, basketball is a big conversation in my house and lots of fun times coming.
Yeah, man. Well, hey, good luck. It's going to be a good series. And I am not from Northern California, but it's been cool to see the team rebound and back to their championship self. So it's been pretty exciting. So you mentioned you are originally from Philadelphia. Tell us a little bit about your hometown and how you ended up heading out west.
Well, in my early 20s, I started a high school in the neighborhood I grew up in. And
started a high school?
Yeah, it was actually the first charter school in the state of Pennsylvania. We re-enrolled kids 18 to 24 who had dropped out of high school, and we rehabbed abandoned houses.
Wow.
So we were both a construction company and a high school. And every single kid who graduated got a job in the pre-apprenticeship program. But the reason I raised that story is two really important lessons came out of it. Was one is that young people are brilliant. Like, we literally hired our first group of young people off the corner where they were selling weed. And what we found is that they were amazing. They just needed something productive to do. And when we connected them to a homeless family, they worked so hard and they were just super amazing. But the other thing I learned in that experiment was how important revenue producing social justice work was. We were a general contracting company and a high school, and we made half of our budget as a general contractor for Section 8 housing. And we didn't have to ask anybody how to spend that money. Like, we could spend it on the things we thought were most important for our school and for our young people. And when I moved into healthcare, I was really focused on that idea that healthcare is one of the most important reimbursement mechanisms for helping people grow and thrive. And it's not just a response to pathology, and we're going to get into this in a second, but like, healthcare can be a tool for justice and for health and welfare. It doesn't just have to be like for sick people. So yeah, it was an important lesson. And after I did that work in Philadelphia, I got my master's degree and moved to California and started working in the Oakland public schools as a therapist. I've always been attracted to kind of young people, young adults in particular, adolescents in particular, and just the kind of wisdom and intelligence and sometimes the challenge of that age. Yeah.
Wow.
That's incredible. How did you come to that idea of forming that school?
Well, it definitely was not my idea. I was 20 something and, I was plunging toilets and leading a construction crew. So, I'm not trying to say I had an amazing woman, Taylor Frome, started that program, and an extraordinary man, Rob Bell. He'd worked in juvenile court and probation world, and he was sort of the father of the program, and Taylor was the mama. So I was just a young buck kind of learning from these amazing mentors. And we moved into an abandoned community center in South Philly and, did the whole thing. It was sort of an amazing experience. But I think beyond the lessons I just said, I think committed people who really believe in the wisdom and intelligence of young people can do amazing things together in partnership with young people. And that was an important lesson early in my career.
Wow. So you're growing up as a kid in Philadelphia. I mean, when you're going to school, is this, as a young kid or in high school or looking at college? I mean, were you thinking of working with kids or how did that come about?
I mean, thanks for that question, man. I mean, I think I was saying to my son that, like, for white people to have an experience with people different than you don't get that experience by talking about it. You get it by doing something together. So I have found that people who have sort of well-adjusted around racial justice tend to be like musicians or athletes, or have had some experience of common endeavor with folks not like them. It can be service too, doing stuff together for other people is a good example of another frame. So that was in high school, I played a lot of basketball. And so I was often like the prep school kid, on some of these teams where kids didn't have the same experience as me. And it was super formative. Even when I went off to college, to Vassar College, kids of color tended to be on the sports teams.
Yep.
And seeing their experience in these really privileged communities was really formative for me, I think. I often do talks for grad students. Mm-hmm. And I recently did one at UC Berkeley. And I repeated something I often say, which is these three things need to happen for you. And this is always weird to give advice like this, but kind of why I'm there is people want to know sort of what formed me. And I said, one is you have to understand the reality of poverty and racism. It's brutal. And so you have to have an experience of being with either young people or families where you're not sure how they're going to make it to the next day. Right. Like that pit in your stomach, if you don't have that experience, you have to go get it. Like if you're here at grad school and you don't know that experience, like you can't name the day you felt that way, before you do anything else, go do that.
Yeah.
And the second thing that has to happen is you have to know how the money works. Like if you don't know who's paying you or everything around you, from the 911 system to the hospital to the mental health system, like if you don't know how the money flows, you're kind of just a sucker. Like you got to know how it actually works. And then third, you have to believe in the wisdom and intelligence of poor people. And you need those three things together, make you an ally. Without any one piece of it, you might be doing more harm than good. No. So if you're asking me, because they often do, like oh, I want to either have a career like yours or I want to do stuff like you're doing, my advice or counsel is check at least those three boxes before you decide what you're going to do.
That's incredible advice.
Yeah, that is good. So walk us through. So you're working at this general contractor / building a high school company. And you mentioned you were at the East Coast doing that. At what point did you come out West and why?
Yeah, like most of us, I think trauma or some challenges like lead to change. Things have to change to get better. So, I had some tragedy in my family. My mother died and sort of gave me a reason to leave my hometown. And I went out to San Francisco to visit my brother, and I fell in love with this amazing woman. So literally, I moved to San Francisco, and this actually is a true story. Gosh, I haven't told this story in a long time. Once a year, I go to a memorial service on the eve of my mother's death. And I went to try to find this service at a Unitarian church. So they have this memorial service. And I literally took a wrong turn in West Oakland. Like if you know West Oakland at all, I literally took a wrong turn on 27th, and I went into this high school, and I 3 blocks into the wrong turn, I ran into this high school where there was like razor wire and broken windows. And my first thought about the high school was it was abandoned.
Yeah.
But it wasn't, because there was a kid sitting on the front step, smoking something, right? And I was like, wow, that was pretty intense. And I went to this service, and at the end of the service, they do this guided meditation that says, everyone dream of a door behind which what you hope rests, and go through it, don't ask for permission. So I literally went home and looked up the name of that high school and sent a note to the principal. And I had the kind of resume that a principal would be like, oh, that guy might know something. And I started working at that high school as a therapist.
As like a counselor, or?
Yeah, I just got my master's degree. I had worked in philanthropy and AmeriCorps. So like, again, I had the kind of resume that a principal would be like, oh, he might be able to help me out, right?
Yeah.
So I needed to earn my hours for my license.
Yeah.
And so I helped them get some money, and they were like, well, why don't you do it? And I was like, okay. It happens to be a high school that's really famous in the basketball world. Bill Russell, Paul Silas, Antonio Davis, like basically a bunch of amazing basketball players went there. It's called McClymonds High School in West Oakland. It's an extraordinary high school, almost all African-American. And I worked there for 7 years, and it was a really formative experience for me. Like, super powerful. I started out in an abandoned broom closet, basically, with the word sanctuary on the outside of the door. No school staff or no school police allowed.
That you wrote that, or was it already?
I did. This school had a full-time police officer and no full-time nurse.
Yeah.
Yeah, it was like a classic, tough school in the mid-'90s, late 90s in Oakland. And I needed to earn my hours, so I got a good supervisor. I'll tell that story if you want it, but I got an amazing supervisor, an African-American woman who was just extraordinary therapist and clinician, trained me beautifully, and I started seeing kids at that school.
Awesome. Well, yeah. we definitely, I'm sure, want to know more about her, but for time purposes, Alex, I'll probably have to save that for another time, but I'm sure you have a lot to share about her. And that sounds like amazing.
Well, the trajectory from there, to go quickly, is I started an FQHC in that high school in partnership with the local children's hospital, full service clinic. We built it all out. And then I worked at the Level 1 Pediatric Trauma Center, Children's Hospital and Research Center at Oakland for a while as a therapist. And then I went to work for Alameda County as the children's health director. A couple years later, I was the health director. And for 7 years, I led the health system there.
Wow, man. That is a lot of good stuff happening in the Bay Area. And for those of you in the audience who don't know, an FQHC is a federally qualified health center or health care center. I always get that mixed up.
Health center. Yeah, basically what FQHCs are is a way to get an enhanced rate. Because Medicaid in California, Medicaid is called Medi-Cal in California. Medi-Cal, unfortunately, pays really poorly. So in order to make it work, you need some way to enhance that rate. And FQHCs are a way to get an extra bump on the rate that Medi-Cal usually pays.
Yeah, so as you kind of you told the story growing up, making it out to the Bay Area with this lovely woman that you fell in love with, which is always a great story. And then you kind of did a quick whirlwind, and now you're at California Children's Trust. Tell us how you ended up there, and give the audience a quick overview of your organization.
Sure. So I really believe in government. So I want to say, my 12 years in Alameda County were super informative and powerful, and I'm so grateful for what I learned there. And they're really tough. It's really, really hard work. And I left that job sad and depressed and in need of rehab. I was definitely in a really tough, low spot. And when I left the county, I started working for philanthropy. And one of my dreams has always been to reimagine how we support the social and emotional health of children. Because I have built a lot of Medicaid mental health services in juvenile hall and foster care and schools, in crisis settings, in general acute care. Be hard pressed to find a setting I haven't built Medicaid mental health in. And I knew that every time I served a kid, I had to give them a diagnosis to get paid. But very small number of the young people I served were actually mentally ill.
Yeah.
the vast majority were dealing with really, really bad things that had happened in their lives. And so I knew, like, just instinctually that children weren't pathological. And so, but I also knew about Medicaid that it was this opportunity. If we could just reimagine Medicaid, it could be something that could change people's lives.
Yeah.
Like it could be an agent of connection and healing. And I also felt that our culture needed something to heal on. Like, I think we can all look each other in the eye and agree that this is a uniquely difficult time. So I proposed to some friends of mine in philanthropy that we run something called the California Children's Trust. And there were some amazing friends who brought this, Reed Connell and Amy Price at Zellerbach. I mean, there's no way to capture the number of people who made this happen. But basically, I was invited into a conversation around what it would take to reimagine the mental health system in California for kids. And so we came up with the idea of doing a 5-year initiative. It's really important because I think that when you try to do big things, they need to have a start and an end. So the Children's Trust is a 5-year initiative to reimagine how the state of California supports the social and emotional health of children. And we're about 3 years in. We got the worst kind of luck, like heartbreaking luck. We started this work looking at some of the self-injury data and the utilization data that I'm sure April and Gavin, you may have seen, you may not have seen. But of course, the pandemic, like, put wind in the sails of everybody's concern about kids.
Yeah.
It's important to note that the data that we started the trust on preceded the pandemic. In the decade before the pandemic started, suicide leapfrogged cancer and car wrecks as a cause of death. So inpatient admissions doubled between 2007 and 2017.
Yep.
Super important to note that the pandemic didn't create this problem. The pandemic put a bunch of gasoline on it and lit it on fire, but it didn't create it.
Yeah, good point. I want to go back to something really quickly that you mentioned about kids having these traumatic experiences, but not necessarily having a diagnosis. One of the things that you mentioned at the California Association for Health Plan conferences a few weeks back in Burbank was this term ACE, Adverse Childhood Experiences, and how they impact kids, which I thought was interesting because I heard that word being thrown around in the conference, ACE. Tell us, I know I just explained it, but maybe just in like 30 seconds.
Well, there's people way better at me at describing it, but I want to say that one of the tasks of the trust has been to crosswalk that work of ACEs, which I'll explain in a second, into reimbursement, practice, and policy in Medicaid. So we are unabashedly Medicaid geeks over here at the trust. Like, we really believe in it and think it can work. But right now, the way it's constructed is like old school. It's like outdated.
Yeah.
And in fact, it imprisons young people in their problems in ways that isn't really relevant to their life. What is relevant to their life is adversity. Remember, 6 out of 10 kids in the state of California are now covered by Medicaid. It's extraordinary growth in the program. And those kids are about 75-80% Black and brown. And 7 or 8 of them will never get out of poverty. And so to live in poverty and to be a young person of color means you will experience adversity in this culture on some level. And the Adverse Child Experience Study was actually created in the late 70s at Kaiser. So it's actually something that's existed for a long time. But California's first Surgeon General, Dr. Nadine Burke-Harris, repopularized and solidified a strategy around bringing ACEs into California's healthcare system. And she really legitimated ACEs and I think the state level narrative around ACEs. She brought it back and repopularized it. We feel a lot of our work at the trust is to follow in her footsteps and make sure it is actually reflected now in practice and reimbursement.
That's great. So speaking of reimbursement, one thing when I last heard you speak is, I think you said for kids' behavioral health, like who follow the money, like who's responsible financially for kids' behavioral health? And there's no simple answer there, which you were frustrated.
Yeah. I mean, at the heart of it, it's like the simplest thing in the world, right? Like in 1967, the military was so freaked out after it had drafted 500,000 poor men into the military and rejected half of them for unfitness to serve. literally, the American military was so freaked out, it sponsored an amendment to the Social Security Act that fundamentally changed Medicaid for kids. It said kids in Medicaid don't have to be sick to get a service. Like, do you have to have measles to get a vaccination? No.
Yeah.
Like, and so what happened is that it created this special, unique status of kids in Medicaid. But the mental health world never reflected that status. It was stuck in old school medical model,
Right.
to use a clinical term, bullshit.
Okay.
That didn't reflect what was actually driving these behaviors in young people. Like, young people aren't pathological. They're actually responding to a toxic culture. You know, a culture that says fame is merit, that wealth is value, that certain people are better than other people, that how you feel about your gender is something to be ashamed of. Like, we have built a toxic culture for young people. And we've inundated them with messaging and media that is sensationalist and unsafe. And when you do that to young people, we know what happens. They feel unsafe. Their risk modulation becomes questionable, and they act out. That shows up in self-injury rates, in mood and anxiety disorders. But that's not, their pathology isn't the driver of it, it's us. And that's that's the fundamental underpinning of the California Children's Trust, is to realign our Medicaid system, our whole system for supporting the social and emotional health of children, with the true root causes of what is causing these challenges. And it is very little to do with individual pathology, and everything to do with growing up in a culture that's actually toxic to your health and welfare.
So what are the main root causes that California Children's Trust is trying to work on? You said you're in year 3 of the 5 years. So what are the main?
Yeah, thanks for that question. So we have a call to action. So we have some very specific things we think you need to change. And I'll go through those. But first, on the root causes, clearly it's complex. So there is no one cause, like any wicked problem, right? There's lots of things contributing. But certainly hundreds of years of structural inequality is part of it. Certainly the availability of social media on mobile platforms beginning in 2009 is part of it. Certainly a culture that negotiates difference in hierarchy. Everything is better than or worse than. I could go on. So I think it's almost impossible to disentangle the multiple causes of this culture. But I think we can all agree, if you ever were a kid, or you have them or work with them, you know that this is a uniquely difficult time to be a child. Like, when I do the data, there's no one in the audience who says, oh, that's not accurate. Everybody knows it's a super tough time to be a child. So we have a very specific set of policies we call out and name. One of them is the removal of diagnosis as a prerequisite for care. You should not have to meet diagnostic criteria to get support. It should be enough to say, ouch, or I'm hurting, or I want help, or I want support. That's super important. It's super important we expand the provider class, meaning who does the work. Like, not everybody needs a therapist or even wants a therapist. And lots of stuff can happen between well-trained people that isn't necessarily clinically intermediated, but it might be clinically articulated. So that's super important, expand the provider class. We have to spend more money. So lest we get it twisted, everybody, California has this thin veneer of progressiveness. When you pull back the onion, we suck. We're 48th in the nation in access to needed mental health care for kids. We're 36th in spending per child beneficiary. We're 48th in spending per kid in schools. That's another one of our recommendations, is to center schools in a response at scale. Co-locate services in schools, because you can never, ever, ever have enough doctors' offices and therapists sitting in boxes. That'll never work. So those are 3 big ones. I've got more for you, but like, if listeners were wanting to know, what is the Children's Trust all about? We're about removing diagnosis. We're about expanding the provider class. We're about spending a lot more money. We're about centering schools. I got others, but those are 4 good ones to hold.
So your initiatives, do they align with SBHIP? And can you share with our audience, what is SBHIP?
Totally, yeah. And so there's so many letters. And I think, a mentor of mine once said, we're all better when we act on the exhale. So before we dig into the acronyms, let's breathe out for a second.
Yeah.
Like, Medicaid on its surface looks really simple, right? Like, oh, You know, it's like a pot of gold in DC. You put up $1, you get $1. California should be really good at it. We got lots of dollars to put up, right? So, but when you unpack how come we suck so bad, it's because when everyone is responsible, nobody is.
Yeah.
And you could ask any person who's worked with young people, so whoever's listening to this, if you want to piss off someone who works with young people, talk to them about mental health. They'll be like, it's a phantom benefit. There's nothing, right? Like, is it the county? Is it the managed care plan? Is it the school? Is it the regional center? Is it the FQHC? Is it the hospital? Who's responsible for kids? And the answer is, when everyone is responsible, nobody is. So at the heart of our problem in California is we have institutionalized our fragmentation and distributed accountability so broadly that it's really difficult to track who's supposed to do what. And I know from having led a public system that we spend so much of our time pointing no, that's your kid. No, that's your kid. No, that's your kid. No, you pay for them. No, right? That's not a problem. And almost all of those decisions were related to money and budget and finance. So, you know, I would begin by saying, everybody breathe out. SBHIP stands for the Student Behavioral Health Initiative Program. So it's a mouthful, and it's part of a landscape of mouthfuls.
Yes.
So in some ways, I would say, like, for everyone, remember the letters, but then forget them. Because at the heart of all of this is the premise that young people are federally entitled to the services and the supports they need to grow up and thrive. And essential to achieving their thriving is going to be to use schools as the new delivery center. Because kids 8 to 18 use the doctor the least. But that's when 75% of mental illness manifests.
Yep.
So just when you need the healthcare system the most, it's not really available to you. So SBHIP is part of a movement to bring schools and health plans together. What I joke, it's a joke, but it's not such a joke. What I say is SBHIP is about health plans and schools going on a date with somebody else's money. Like, because the SBHIP is $389 million of post-capitation payments, meaning it's money on top of what health plans usually get, and it's a 4-year program meant to create a relationship between schools that generates long-term partnership. So all of these things are important to understand about SBHIP. It's part of a larger movement to center managed care organizations, AKA health plans. Mm-hmm. Remember, 10 years ago, only about 10 to 15% of kids were in managed care plans. Today, 90% are. So really important, if you want to understand Medicaid, in every county, there's a different constellation of managed care organizations. It's really important to know what the health plans are in your county.
Oh, yeah.
And they didn't even have a mental health benefit until 2015. Now that they do, it's important that all of us hold their feet to the fire to pay for stuff.
I like it.
Yeah, SBHIP is basically a first step in building a bridge between managed care plans and schools.
And hopefully it's a change that keeps momentum, right? It's not just a temporary thing here. So that's great.
Yeah, but what I would say is what we want to leave behind, meaning SBHIP is 4 years, it's a bunch of money, go on a date with somebody else's money, super good, right? But what we wanted to leave behind is a permanent reimbursement stream for mental health services that happen on schools. So we call that non-specialty mental health, fancy word for the mental health benefit, and new care coordination contracts between managed care organizations and school-based providers. So that's really important to note that we need both. We don't just want the health plans to pay for a therapy session, because first of all, they don't pay enough anyway. It's like $60-$70. It's too little. And then second, I walked around McClymonds High School for years saying what's up to the same kid, talking about stuff, until I learned they were sleeping in a car. Mm-hmm. It don't matter how good a therapist you are if no kid will talk to you.
Yeah.
And health reimbursement has to account for that alliance building. All therapeutic gain presupposes therapeutic alliance. If you aren't trusted, if a young person doesn't feel like you can help them, they won't talk to you.
Yeah.
And it sounds like this is the tip of the iceberg. As you said, this is step one. what do you see as a long-term vision, or if not long-term, step 2? Do you want to bring more services into the school? Do you want to bring behavioral health into more environments? What would be the next thing? Because you're going to crush this. You and others that are really passionate about behavioral health will make sure that we get the data to get that long-term funding. So we got to start looking at what's next, probably soon, I would imagine.
Yeah, thank you, April, for that question. You gave me chills with it. Yeah. So first is I could name 600 new school-based mental health programs that have launched in the last 6 months.
Nice.
It's happening. It's messy. Okay. People use the same words to mean different things. It's filled with this. Adults carry more stigma than kids. Like, young people are talking about their social and emotional landscape because it's in their face, in their minds, in their hearts at all times. Adults are the ones carrying stigma. So schools, it's happening, but it's kind of ugly and uneven. So in the near term, I would like to see every single school invest in structured models of support for the social and emotional health of every child in their school. So not just the kids who have an IEP, not just the kids who are crying, who need one-on-one attention, but it's something that's available to everyone. So we call that the MTSS. It's a fancy word, multi-tiered systems of supports. But just think like triangle. At the top are the kids with an IEP, in the middle are the kids who have a real identified need, and at the bottom is everybody. Yeah. And I would like to see every school have services, has defined service and supports at all 3 levels. Every kid gets something. The kids who need more get something specific, and the kids who have high needs get it in a structured way through an IEP. So 2 to 5 years, I hope that every school has like a robust mental health program and support. Long term, sort of 5 to 10 years, I hope mental health is reimagined as a support for healthy development, not as a response to pathology, informed by the principles of social justice and anti-racism. Meaning, young people have to know how to resist the culture that is raising them. It's not safe. It is not looking out for them. Individuals are, communities are, but broader messaging, what's available to them through their phone, which they interact with more than any single adult every day, that thing is not on their team. And they have to understand how to use it responsibly and interpret the messages it sends them. And I think that means understanding the broader forces at work in this culture. And so that isn't necessarily about your behavioral health diagnosis.
Right.
It's about differentiating the images that you see from your sense of self, knowing what's real, what's true, being able to laugh at it, knowing the history, knowing who's behind it, understanding the construction of it. Those are all actually essential elements of the future of mental health.
Absolutely. And I'm sure you've heard of CalAIM. It's a hot topic here in California right now. And CalAIM will extend the ability to have more home and community-based services and be able to attack social determinants of health through both clinical supports and community supports that may be non-clinical. How do you envision CalAIM or community support providers really working together with behavioral health to lead to what you're looking at, being able to attack it everywhere, not just in a therapist's office?
Oh, I love it. Yeah. Well, it's super hopeful. Remember, CalAIM at part is like the renegotiation of these 2 waivers that define our system, right? So that's all super technical. But, I really appreciate, we have the best leadership at the state right now. Like, when I led a county health system, I literally thought the state was a joke. Like, the state would call me and I'd be like, what? You trying to take my money? How are you helping me? Get away. Kind of, literally, I was like that. We now have leadership at the state across multiple major departments who are like truly incredibly thoughtful, talented people. And I think they looked out at the landscape and they saw, wow, we have the nation's largest Medicaid program, and particularly for kids, by any standard measure, among the worst. So when you look at CalAIM, it's an ambitious acknowledgement that we have to fundamentally reimagine and reform what we do across multiple sectors. And at the heart of it, you're absolutely right, April, is to try to shift the medical model to start investing in the types of things that actually lead to improved health outcomes, like housing, like care coordination, like relationships, like other things. And the problem is the system is really resistant to that. Yeah. Like, it's going to be arduous and really, really difficult. Health plans pay for services. It's really tough, man. They process claims. They're basically just a bank, right? So teaching them about race and poverty and housing and juvenile justice and child welfare, these are all things that they don't know jack about. So I think you're right to frame Colleen that way. It's an attempt to shift the healthcare system towards the social determinants of health and move it away from sort of the clinical box. That being, it's easier to said than done.
Absolutely.
And I think it's going to be super uneven. But I think you're seeing an unprecedented investment, meaning commitment of resources. Mm-hmm. Please, to everyone who's listening, please learn how to differentiate between one-time investments and ongoing systems change.
Absolutely.
Super important. So I hope everybody heard me when I said the deep respect and admiration I have for state leadership. But it is easy to make big commitments when money is falling out of rich people's pockets like the way it is right now.
Mm-hmm.
Yeah.
You have a $90 billion surplus, you can still throw money around.
Yeah.
And so I would say that Kalim has a lot of important changes. They're going to be tough to implement. They're the right direction. Too much of the reform is based on one-time investments. I'm sorry, part critique, part hopefulness there, I think.
Yeah, that's a great call out. Not insulting anyone who's doing these good things, right? But just reminding folks this is a not a quick solution here. So, Alex, man, one thing at the CAP conference is you joke, you say you talk fast, right? And to me, I don't see it that way. Maybe a little bit faster than a normal person, but it's just the passion, man. And we can do this. We can probably go on for hours. So I know maybe next year have you on and see what updates are. April, I want to thank you for joining as well, because your knowledge, and folks who don't know April Stewart, she's an awesome follower on LinkedIn. She's really a guru, as is Alex, obviously. But encourage you folks. Alex, are you active on LinkedIn, or how do folks follow California Children's Trust? Like, what's the best way to see what you guys are up to?
Yeah, so the best way is to go to our website, www.cachildrenstrust.org, one word. You can sign up for our newsletters. We are active on social media. I personally am not. I think once you've worked at a level 1 pediatric trauma center, that isn't the most attractive place to do business anymore. But we are active as an initiative. And so I would suggest best thing to do is go to the Children's Trust, read our website, sign up for our newsletters, and sprint with us to the finish line over the last 2 years of our initiative. And let's try to heal as a culture.
Awesome, man. Well, hey, well said. And again, folks, Alex has been our guest. Maybe you'll find him on the basketball courts out there in San Francisco as well. Thanks again, Alex, for joining.
Thanks, Shaw.
Thanks, everyone, for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.